what we see is that most healthcare organizations don't lose revenue because of a lack of effort, but rather it's because their revenue cycle work is still depending on systems that are disconnected, manual follow-ups, delayed visibility, and a lot of preventable rework. And so in this video, we'll explore how AI is changing the way healthcare organizations are managing claims, denials, and payer communication, and why more providers are using automation to simplify revenue cycle operations without replacing their existing systems. My name is Marty, and I work with OSP, helping healthcare organizations build smarter medical billing, revenue cycle interoperability, and automation solutions. Let's look at where AI fits into the revenue cycle today and where it delivers measurable value. Revenue cycle teams have always depended on people, processes, and technology working together. But as claim volumes grow and payer requirements become more complex, manual workflows are just becoming harder to sustain. RCM teams are loaded with claim status checks, payer follow-up, denial queues, authorization paperwork, and fragmented workflows. When the workflow depends on manual checks and disconnected systems, every claim carries more risk than it should. The result is slower collections, rising administrative costs, increased pressure on staff, and less visibility into where revenue is actually getting delayed. And most revenue cycle breakdowns don't happen because of just one major mistake. They happen because small issues slip through multiple handoffs. Missing authorization, maybe an incorrect modifier, eligibility gap, duplicate entry, or coding mismatch. It may not look serious at the front desk, but later it becomes a rejected claim, a denial queue, a payer call, an appeal, or a write-off. So catching these issues early is far easier than fixing them after a denial arrives. The earlier the system catches issues, the less expensive the problem becomes. And one of the most valuable applications of AI is claim scrubbing before submission. Instead of relying entirely on manual review, AI can analyze payer-specific rules, coding patterns, missing information, and historical claim outcomes to identify potential problems before they become denials. By improving claim quality upfront, organizations can increase the clean claim rates and reduce the amount of downstream rework required from billing teams. Once a claim has been submitted, AI can continue supporting the workflow by monitoring payer responses, tracking claim status, and identifying accounts that require attention. Rather than having staff repeatedly log into multiple payer portals or spend hours making phone calls, automation can surface the exceptions that actually need human intervention. Denial management is another area where AI delivers practical value. Instead of treating every denial equally, intelligent systems can group denials by root cause, prioritize high-impact accounts, and recommend the next appropriate action. AI can also assist with appeals by organizing support documentation, routing cases to the correct teams, and helping ensure deadlines aren't missed. But no RCM automation strategy works in isolation. The EHR, practice management system, billing platform, clearinghouse, payer portals, and reporting environment all need to share accurate data. If those systems remain disconnected, the automation layer will simply automate incomplete information. The effectiveness of AI depends on the quality of the underlying data. When EHRs, billing systems, clearinghouses, and payer platforms exchange information seamlessly, automation becomes far more accurate and far more reliable. So why come to OSP? OSP positions autonomous AI agents across claim scrubbing, payer follow-up, denial management, prior authorization, payment posting, and AI claims management while connecting to existing EHR, billing, clearinghouse, and payer systems. At OSP, we focus on building healthcare software around the actual operating workflow, and that can include custom RCM platforms, medical billing automation, AI claim workflows, payer follow-up agents, denial management systems, analytics dashboards, EHR integration, and clearinghouse or payer connectivity. So if your organization is trying to reduce denials, speed up reimbursement, modernize billing operations, or build a custom RCM workflow that fits your actual business, OSP can help you with that path forward. Visit osplabs.com to schedule a revenue cycle or medical billing software consultation. Thank you so much for watching.